Hello everyone. Welcome back to Nursing Guru. Today we are going to discuss about the scope of nursing. The scope of nursing is very important topic for both BSc nursing and general nursing. Let us move to the video. The Florence Nightingale, who is the founder of nursing, and in this video I am explaining about the scope of nursing. After completing nursing, we can work as a staff nurse. Who is staff nurse? Staff nurse is a provide direct patient care to one patient or group of patient, and she is responsible for ward and she is going to assist in the ward management. This is about the staff nurse. And the next one, she can work as a ward sister. Ward sister means she is responsible to the nursing superintendent for the nursing care and for the nursing management. She is going to tell about the care, or she is going to tell the superintendent for the nursing services, and she can go round on any time. She is going for round and she is going to allot the patient to the nurses, and she is going to put the shift for the nurses. This is the job of ward sister. The next one is teaching in nursing. Teaching in nursing includes various of opportunities. She can work as a tutor and associate professor and clinical instructor, lecturer and professor in nursing. These are the opportunities which are provided in the teaching in nursing. The next one is industrial nurse. She is going to provide the first aid treatment during the illness, because the industries, the workers are going to get accidents or injuries, any emergency situation. She is going to provide the first aid treatments, and she is going to provide health education also, and regarding the prevention of accidents. And she can work as a military nurse. The nurse become the part of Indian Army. She is going to provide the health care for military person and their family members. During the war, they get any injuries, she is going to provide the first aid treatment. The nursing services in abroad. The attractive salaries and promising professional opportunities are making the Indian nurse to work in the abroad. If the Indian nurse want to go for a abroad, she have to pass the bridge exams. For example, like OET exams. Without passing in the bridge exam, she cannot work in the abroad. So nowadays the opportunities working in the abroad is become more. Then community health nurse. Community health nurse is the nursing care provided outside the hospital and health education for the community in school and homes. The nurse have to visit the community and she have to provide some health education to the community people. This is the work of community health nurse. And coming to the next one, she can work as a nursing superintendent. She is responsible for planning and development of nursing services in the hospital, and she is also responsible for maintenance of health record. The nursing services in administrative level. Here the maintenance, the budget, and she is going to take care of financial matter of the hospital. So she is acting as a license between the nurse and other health workers like doctors or lab technician. With them, they are going to act as a license between the nurse and between the health workers. And home care nursing. Today the home care nursing having wide range of opportunities, because home care nursing is a cost efficient and it is the care provided to all age peoples and with the convenient manner. The patient is receiving the care in home itself. With the patient convenient, we are going to provide the services in the home. That is known as home care nursing. And the last one is telehealth nursing. Telehealth nursing means it involves the video conference or wireless communication to connect the patients with health services. This technology helps the patient to receive the appropriate care at the right time at the right place. For example, teaching the diabetic patient how to clean the wound in home itself. Because of this, no need of going for hospital again and again. Through the help of telecommunication only, the patient is going to receive the information. This is about telehealth nursing. In today's class, we will discuss about the important topic, that is the scope of nursing. In scope of nursing, we discuss in that staff nurse, community health officers, the nursing services in abroad and home care nursing, telehealth nursing, the nursing supervisor, the nursing superintendent, ward sister and military nurse and the industrial nurse. If you have any doubt, please comment below. If you are new to our channel, please subscribe our channel and enable the bell icon. Thank you. Bye.